Hey everyone, my name is Aaron Kim, and today I'll be presenting about sleep problems and substance use among adolescents. So to give a brief introduction about myself, as I said before, my name is Aaron Kim, and I'm currently attending Seoul International South Korea. Here I'm a rising junior in the class of 2024, and my current field of interest is global health, psychology, more specifically, health risk behaviors and mental health. I currently have a lot of interests and passions such as basketball, mental health issues, and simply helping out the community, which is why I joined a club called Students Against Destructive Decisions and Liberty in North Korea. Through these activities, I was able to further expand and build my interest in health risk behaviors among the youth. Now, with that aside, I'll begin with a presentation of sleep problems and substance use among adolescents. Before we jump into the topic, it is imperative to understand why adolescents are the subject at hand. According to the Ohio Adolescent Health Partnership Strategic Plan, adolescence is a unique developmental period characterized by distinct and dramatic developmental, physical, social, emotional, and intellectual changes. This quote allows us to understand that adolescents are very vulnerable in this time of their life, which is why I chose to research on them. So the topic of how adolescent substance use relates to sleep problems sheds light on the mental health side of global health, as it displays the negative coping methods adolescents adhere to based on improper influences or education. Now, when speaking about substance use and other mental health issues among adolescents, this topic is no stranger as many of them are unaware of the substances can bring. This is what makes substance use and sleep problems so devastating to adolescents. Now, to give a brief introduction or description of sleep problems, it can be simply explained that it's a low quality of sleep, which can result from a lack of sleep, constantly waking up while sleeping, or the inability to sleep, and much more. According to the analysis indicated by the National Sleep Foundation, 75% of pre-adolescents and 45% of adolescents exhibit sleep problems. And furthermore, according to the CDC, up to 70% of US adolescents regularly sleep less than 8 hours per day. Now, it's important to understand that from the WHO, they recommend that adolescents aged 13 to 18 to sleep between 8 to 10 hours per day. Now, knowing this, adolescents with shorter sleep were 38.1% more likely to have suicidal ideation than those getting 7 or 8 hours of sleep. Now, as a result of sleep problems, there are two main effects that arise. First, if you look into this by behavioral aspects, sleep problems increases the likelihood teens will suffer from low concentration, anxiety, depression, suicidal ideation, and even substance use. Now, if you look into this into a biological lens, chronic sleep deprivation in adolescents also diminishes the brain's ability to learn new information, leading to depression, aggression, slower reaction times, and the reduced ability to consolidate memory due to the lack of serotonin and dopamine. But in this presentation, I'll be focusing more on the behavioral side. Now, the next aspect is substance use. According to several research articles, teens commonly use alcohol, tobacco, and vapes because of the ease of accessibility of them. And almost all convenience stores and gas stations sell these products. And even though they're not meant or geared towards teenagers, they're still very much available to them. According to the Sleep Foundation, alcohol may actually aid with sleep onset due to its sedative properties, allowing you to fall asleep more quickly. However, definitely that doesn't mean that you should be taking alcohol to sleep, because people who drink before bed often experience more disruptions in their sleep cycle later in their life, as liver enzymes metabolize alcohol. Because of this, teens often turn to drugs as an unhealthy coping mechanism as they may be trying to use it to solve their problems such as stress, painful emotions, lessen social anxiety, or simply sleep better. Now, when both of these problems, sleep problems and substance use, are brought together in the same scope, sleep deprivation downregulates dopamine receptors, which makes adolescents more impulsive to take more substances and also makes them more vulnerable to the effects on their lives. Now, I conducted a few literature reviews on this area, and what I found out was that shorter sleep actually associated with the increased odds of marijuana use by 14%. To wrap things up, here are some ways to address this global health issue. The first is obviously we should all work together to raise awareness on this, as this is a definite global health issue, and this can be done educating the youth, such as educating the youth in a school environment, or seminars, or simply places like this, the Global Health Leader Conference. Now, also, policymakers should make necessary changes and adjustments to assist these adolescents and allowing them to make better choices in their lives and guide them to the right path to resolve these issues. Now, this is when I ask you, for those of you who are watching this presentation, to ask yourself these two questions. In what ways can the school environment provide assistance to adolescents in promoting better sleep qualities? And two, does more and deeper sleep justify the dependency that forms with substance use? Here are my references that I used to make this presentation. And thank you for listening. Thanks to the Global Health Leader Conference at JHU for providing me this opportunity. And here's my email if you have any questions. Thank you.